Boosters advice here. There's lots of information that's come out. We are working with a media company to try to make sure that and make more and more people aware, especially persons 50 and over, that of boosters that are available. We really want to make sure that people know that if it's been since December of 2021 since you had a booster, now's the time to get that next booster. And the state has put up a tool, and thank you, Todd Luck, for putting it on our Facebook page and sharing that. There's a tool now that's available, and you can see it where you can go through the Division of Public Health and you can click and it asks you some simple questions. It's anonymous. Is your age, what vaccine doses you got before, first, and boosters, the timing, and it can tell you, is now the time to get another booster. The biggest overarching theme is, especially if you're over 65, you should get another booster now. And if you're over 50, it's probably a good idea. If you're under 50 but immune compromised, that's a decision you'll have to make. You can talk to your healthcare provider, but lots of people are immune compromised, and we're suggesting people to get that booster so they can get that protection. Going forward, again, encouraging people to stay up to date on their COVID-19 vaccines. That's the most important piece for protection. Take an at-home test, stay home. If you're feeling sick, go get tested at a location, but really encouraging people to have that at-home test or a plan where they know where they can get tested and to get treatment right away if they test positive. Well, that's, there's no avenue, whether through the state, even through the counties, and really, we don't have the bandwidth right now to take, what could be, let's say it's 5 to 1, so that would be 4,000 calls a week. We don't have that bandwidth to do that. We would encourage people, to get, to isolate us and quarantine. I guess isolation if you're sick. This means if you're ill, encourage your close contacts to quarantine or monitor themselves for symptoms. But I do wonder too, you see our percent positive going up, and this would probably be a better question for Dr. Ohl. But I wonder how many people take an at-home test, it's positive, and then they're like, I just want to confirm it. So then they go get a lab confirmed test. So that might mean that more, people that are almost already pre-screened, so they're more likely to be positive. That might be making our percent positive go up. That makes sense. Whereas maybe a year and a half ago, so many more people were getting lab confirmed tests. If it's 1 out of 10, that means your percent positive is 10%. If it's 1 out of 20, you're 5%. But now that those that are taking that step to get the lab confirmed test, maybe they either are more cognizant of their symptoms, so they're more likely to have COVID, or they have already screened themselves by taking the at-home test and they just want to verify it. I think, we're going to have to learn to live with COVID. I think that's the thing. We're going to have to learn to live with it, and how can we do that safely, just like we live with the flu, it's like we live with the common cold. But I think the concern is, we've seen that COVID, and we know that COVID can be deadly. Yes, it's 1 in 100 for the general population, but for some high-risk groups, especially those 75 and over, what I've seen is it's more like 1 out of 10. So it's 10% mortality. So at least it was at one point in time, or in the beginning of the pandemic. Thankfully, that population is very highly vaccinated. Over 95% of that population is fully vaccinated, and a large proportion are boosted. But I think it's just going to be, something we're going to have to learn to live with. And the other thing that I'm concerned about, and this is, we've obviously focused so much about, how many people die, but how many people have long COVID? And that's something we're still trying to learn about. We do know the early research shows that people that are vaccinated are less likely to get long COVID. Do know that.